In this video, I'm going to teach you how to do a figure of 8 stitch. This stitch is useful for a couple things. It's basically good in areas where you may have some tension and you want to bring that tissue together but do not have the subcutaneous tissue to do a deep dermal closure or a subcutaneous closure, or maybe don't even have the tissue underneath that to do a vertical mattress, which is going to help decrease that tension. So it's a good one they can use to decrease tension. People will also sometimes use it to ligate vessels or bleeders. They basically do the stitch over the vessel and try to close it up. So I'm going to basically walk you through those steps on how to make this stitch. Usually in a figure of 8, you're going to be using a larger needle where you can get a big bite. If it's a small area, small stitch, you can use a smaller needle. This is going to be a 3/0 nylon with a large needle. And you can see in this wound, this is a relatively gaping wound, and I'm going to just pretend that I don't have that subcutaneous tissue to do that closure, and I'll show you how to make this stitch. The first step is just grabbing your tissue, and you're going to, again, insert at 90-degree angle to the skin. Coming out in the subdermal area, you're going to cross that stitch diagonally across the wound like so. So you're not opposing it exactly like you would in the other stitch. I'm going to do a load and repeat the process on the other side. So you've reloaded your needle, and basically you can see this is going across horizontally, and now you're going to cross over directly over the wound, reinsert into the skin, and basically you can see this is going across diagonally. So you kind of formed an X inside of that wound. You come to the opposite side, parallel to the initial entrance, pop it out, and pull it through. Let's see if we can show you this stitch here. You don't want that over the line. Make sure nothing's going underneath. But basically at this point, you can see it's almost like tying your shoelace. And when you're going to bring that, you're going to pull that together, and it closes that large area of skin, decreases the tension, and doesn't require any deeper stitches. If this was a vessel, you'd try to get that vessel, that piece of tissue that's bleeding, in between those crosshairs and kind of take that bite to really pull it in. So when you tighten it up, you're going to be kind of ligating it. At this point, you basically do your basic double throw for your instrument tie. Pull it across, and it closes like that. And then basically after that, you're going to be throwing your other ties and going from there. Second tie. Third tie. Fourth. And again, I usually do 5 ties on this, sometimes 6, especially with nylon. They sometimes will come apart. This is your stitch. Holding that area of tension by putting it across the surface, and then I'll basically throw 2 more and we'll see the final product. So basically, to recap, you can see this is 3 figure of 8 sutures. It was a relatively gaping hole initially, and it brings that tension down. So this stitch is a good option to have up your sleeve when you need to close a wound that's superficial but under some tension.